Good afternoon. This is All India Radio. I am Valsa Williams, and with me is Prashant Kumar Sinha with the Midday News. The headlines. Prime Minister Narendra Modi shares his thoughts with citizens in Mann Ki Baat, says India's fight against corona is people-driven. Prime Minister reiterates the importance of physical distancing, says "Do gaz doori hai zaruri" is the mantra and masks are the new norm in the fight against COVID. Mr. Modi lauds the role of citizens and government agencies in reaching out to people during lockdown. Prime Minister says people should not get complacent in the fight against COVID, calls citizens to join hands with 1.25 crore COVID warriors. UP and MP start the process of bringing back stranded workers from other states. And standalone and neighborhood shops open in non-hotspot zones in many states. Prime Minister Narendra Modi has said that India's fight against corona is people-driven, and along with the people, the government and the administration are fighting the pandemic. Sharing his thoughts in the Mann Ki Baat program of All India Radio today, Mr. Modi said each and every citizen of the country is a soldier in this battle, and they are leading the battle. He lauded the resolve of the people as to how, at each and every place, people have come forward to help each other.
भारत की कोरोना के खिलाफ लड़ाई सही मायने में पीपल ड्रिवन है। भारत में कोरोना के खिलाफ लड़ाई जनता लड़ रही है, आप लड़ रहे हैं। जनता के साथ मिलकर शासन प्रशासन लड़ रहा है।
The Prime Minister said from arranging food for the needy to supply of rations, compliance of lockdown, from arrangements in hospitals to manufacturing medical equipment indigenously, the entire nation is marching ahead together. Mr. Modi urged people not to get caught in the trap of overconfidence and not harbour a feeling that if corona has not yet reached their city, village, street or office, it is not going to reach now. Mr. Modi said "Do gaz doori hai zaruri" should be our mantra, and people should maintain a distance of 2 yards and keep themselves healthy. The effect that is most visible now is wearing a mask and covering the face. Mr. Modi said in the changed paradigm due to corona, masks are becoming a part of the lives of people.
मास्क को लेकर भी धारणा अब बदलने वाली ही है। आप देखिएगा, मास्क अब सभ्य समाज का प्रतीक बन जाएगा। अगर बीमारी से खुद को बचना है और दूसरों को भी बचाना है तो आपको मास्क लगाना पड़ेगा। और मेरा तो सिंपल सुझाव रहता है, गमछा।
Mr. Modi said another awareness that has come about in society is that people now understand the damage that can be caused by spitting in public places. He said it had been a part of the bad habits that people would spit anywhere, and it presents a serious challenge both to cleanliness and to health. He said people must discard the habit of spitting completely.
ये स्वच्छता और स्वास्थ्य को गंभीर चुनौती भी देता था। वैसे एक तरह से देखें तो हम हमेशा से ही इस समस्या को जानते रहे, लेकिन ये समस्या समाज से समाप्त होने का नाम ही नहीं ले रही थी। अब वो समय आ गया है कि इस बुरी आदत को हमेशा हमेशा के लिए खत्म कर दिया जाए। कहते भी हैं कि बेटर लेट देन नेवर, तो देर भले हो गई हो, लेकिन अब ये थूकने की आदत छोड़ देनी चाहिए। ये बातें जहां बेसिक हाइजीन का स्तर बढ़ाएंगी, वहीं कोरोना संक्रमण को फैलने से रोकने में भी मदद करेगी।
The Prime Minister said the resolve of the countrymen displayed during the crisis has led to the beginning of a new transformation in India.
हर मुश्किल हालात, हर लड़ाई कुछ न कुछ सबक देती है, कुछ न कुछ सिखा करके जाती है, सीख देती है, कुछ संभावनाओं के मार्ग बनाती हैं और कुछ नई मंजिलों की दिशा भी देती हैं। इस परिस्थिति में आप सब देशवासियों ने जो संकल्प शक्ति दिखाई है, उससे भारत में एक नए बदलाव की शुरुआत भी हुई है। हमारे बिजनेस, हमारे दफ्तर, हमारे शिक्षण संस्थान, हमारा मेडिकल सेक्टर, हर कोई तेजी से नए तकनीकी बदलावों की तरफ भी बढ़ रहे हैं।
The Prime Minister said the centre, state governments, each and every department and institution are working hand in hand for relief at full speed. People working in the aviation sector and railway employees are working day and night to alleviate hurdles confronting the countrymen.
कि देश के हर हिस्से में दवाइयों को पहुंचाने के लिए लाइफलाइन उड़ान नाम से एक विशेष अभियान चल रहा है। हमारे इन साथियों ने इतने कम समय में देश के भीतर ही 3 लाख किलोमीटर की हवाई उड़ान भरी है और 500 टन से अधिक मेडिकल सामग्री देश के कोने-कोने में आप तक पहुंचाया है।
Underlining the government's commitment to help the needy and poor, the Prime Minister said money is being directly transferred into the accounts of the poor as part of the Pradhan Mantri Garib Kalyan package.
प्रधानमंत्री गरीब कल्याण पैकेज के तहत गरीबों के अकाउंट में पैसे सीधे ट्रांसफर किए जा रहे हैं। वृद्धावस्था पेंशन जारी की गई है। गरीबों को 3 महीने के मुफ्त गैस सिलेंडर, राशन जैसी सुविधाएं भी दी जा रही हैं। इन सब कामों में सरकार के अलग अलग विभागों के लोग, बैंकिंग सेक्टर के लोग एक टीम की तरह दिन रात काम कर रहे हैं।
Expressing his deepest regards for the medical service personnel across the country, Mr. Modi said the doctors, nurses, paramedical staff, community health workers and all such personnel are working round the clock to ensure a corona-free India. He said, we need to ensure their safety and the ordinance that has been issued recently is a step in this direction. The ordinance provides for stringent punishment for those harassing, injuring or indulging in violence against corona warriors. Giving the example of household help, common workers who fulfill our various needs, personnel working in shops nearby, personnel delivering essential services, labourers working in marketplaces, auto rickshaw drivers in the neighbourhood. Mr. Modi said today people realise how difficult their lives can be without them. The Prime Minister said doctors, cleaning staff and other such services personnel and even the police organisations are being seen in a new light by the common people. He said today the police personnel are ensuring that food and medicines reach the poor and the needy. He added that it is a time when common folk are connecting with the police at an emotional level. Mr. Modi said the government has come up with a digital platform, covidwarriors.gov.in. He appreciated that in a very short time, 1.25 crore people including doctors, nurses, ASHA, A&M workers, NCC and NSS cadets, professionals from different fields, have become a part of this portal. He urged people to join covidwarriors.gov.in to be a COVID warrior and serve the country. The Prime Minister highlighted that during the crisis, India provided medical supplies to the needy across the world in line with its humanitarian responsibility. He said people across the world are paying special attention to the importance of India's Ayurveda and yoga and its role in boosting immunity. Mr. Modi urged people to follow the corona-related protocol to boost immunity by the Ministry of Ayush. He added that warm water, decoction and other guidelines issued by Ayush Ministry would be very helpful for people. Mr. Modi said it has been our misfortune that we always refuse to acknowledge our own strengths and glorious traditions. He underlined the need for the younger generation to go in for evidence-based research to propagate our traditional principles in scientific language. He said just as the world has happily accepted yoga, the world will surely also accept the age-old Ayurvedic principles. The Prime Minister called upon citizens on Akshaya Tritiya to give a thought about the preservation of the environment, forests, rivers and the entire ecosystem.
क्षय का अर्थ होता है विनाश, लेकिन जो कभी नष्ट नहीं हो, जो कभी समाप्त नहीं हो, वो अक्षय है। अपने घरों में हम सब इस पर्व को हर साल मनाते हैं, लेकिन इस साल हमारे लिए इसका विशेष महत्व है। आज के कठिन समय में यह एक ऐसा दिन है जो हमें याद दिलाता है कि हमारी आत्मा, हमारी भावना अक्षय है। यह दिन हमें याद दिलाता है कि चाहे कितनी भी कठिनाइयां रास्ता रोके, चाहे कितनी भी आपदाएं आए, चाहे कितनी भी बीमारियों का सामना करना पड़े, इनसे लड़ने और जूझने की मानवीय भावनाएं अक्षय है।
The Prime Minister added that if people want to remain bestowed with renewable resources, then they must first ensure that the earth remains ever abundant. He recalled that the day marks an important day in the life of the first Tirthankar, Lord Rishabdev, and it is also the birth anniversary of Lord Basaveshwara. He said the holy month of Ramzan has begun and people should pray more than ever before, so that before Eid the world is free from corona and people can celebrate Eid with enthusiasm. Mr. Modi urged people to follow the guidelines of the local administration during Ramzan, as it is very important to follow the rules of physical distancing in the streets, markets and in mohallas and colonies.
इस रमजान को संयम, सद्भावना, संवेदनशीलता और सेवा भाव का प्रतीक बनाएं। इस बार हम पहले से ज्यादा इबादत करें ताकि ईद आने से पहले दुनिया कोरोना से मुक्त हो जाए और हम पहले की तरह उमंग और उत्साह के साथ ईद मनाएं। मुझे विश्वास है कि रमजान के इन दिनों में स्थानीय प्रशासन के दिशा निर्देशों का पालन करते हुए कोरोना के खिलाफ चल रही इस लड़ाई को हम और मजबूत करेंगे।
Mr. Modi expressed gratitude to all those community leaders who are making people aware about the 2 yards distancing and not going out of the houses. He said corona has changed the manner of celebrating festivals all over the world, including India, and it has changed the way of their observance. In Telangana, many people expressed happiness over Prime Minister Narendra Modi sharing his feelings about doctors and medical professionals. They stressed on the need for extending support to the government by staying home and observing social distancing. K. Rajkumari from Warangal district expressed thankfulness to the police, health workers and sanitation workers.
हमारे प्रधानमंत्री श्री नरेंद्र मोदी जी ने मन की बात में अपनी प्रसन्नता प्रकट की कि कोरोना मुक्त भारत बनाने में जो लगातार कार्यरत है, जो डॉक्टर है, नर्स, सफाई कर्मचारी, पुलिस है, उनकी सेवा अनमोल है। हम उनके कृतज्ञ हैं।
Anupama from Nizamabad says India's youth should come forward to uphold the culture, as the Prime Minister says in his Man Ki Baat.
आदरणीय प्रधानमंत्री जी की मन की बात द्वारा बड़ी अच्छी बातें कही। एक तो आज अक्षय तृतीया का दिन। हमारा भारत देश हमेशा से विश्व के लिए अक्षय पात्र रहा है। वह इसे अखंड रखने की जिम्मेदारी हम पर है। हमारी भारत की संस्कृति अनादिकाल से श्रेष्ठ रही है और रहेगी।
Reacting to Man Ki Baat, Union Minister Prakash Javadekar highlighted the importance of discipline in the fight against coronavirus. As certain relaxations are announced in lockdown by the Ministry of Home Affairs, some states are acting to bring back the stranded migrant laborers in various parts of the country. Uttar Pradesh and Madhya Pradesh governments have initiated process to bring back their stranded laborers in different parts following the guidelines of the Ministry of Home Affairs. This is expected to bring some respite to the laborers stranded in different parts for the last 33 days due to nationwide lockdown in view of COVID-19 pandemic. The Uttar Pradesh government has begun bringing back the state's native workers stranded elsewhere in the country and has ensured the return of 2,224 of them in the first phase, as per a senior official. Uttar Pradesh Chief Minister Yogi Adityanath had issued directions to bring back labourers belonging to UP from other states in a phased manner. In Madhya Pradesh, labourers stranded in other states have started returning to the state. Apart from this, labourers of other states stranded in Madhya Pradesh are also being sent back to their respective states. Labourers of Madhya Pradesh working in Jaipur and other cities have started coming from Rajasthan. 2,400 labourers from Gujarat have left for Madhya Pradesh in 98 buses. Chief Minister Shivraj Singh Chauhan has said that the government has started the work of bringing back the labourers of Madhya Pradesh stranded in other states by buses. Rajasthan Chief Minister Ashok Gehlot said yesterday that migrant workers stranded in various states will be able to move out of or back to Rajasthan in a phased manner with mutual consent of the other states.
The migrants who want to return to the state will have to register through helpline number, e-Mitra portal and e-Mitra app. After this, the government will get consent from the concerned state government. As per the number of registered migrants, arrangements will be made to send them back to their homes as per the scheduled date and time. The persons who want to travel through their vehicle have to mention the registering. While registering, the medical department has been instructed to make arrangements for screening. The transport department has directed to arrange buses and the administration to make arrangements for temporary accommodation and food at the state borders. The state government has said that strict action will be taken against the violators of the rules. Jitendra Dwivedi, AIR News, Jaipur.
In Assam, 6,000 stranded people are undertaking inter-district bus journey today. Managing Director of the Assam State Transport Corporation, A.P. Tiwari, said that 200 long-distance buses are being operated today. He said all the norms, including social distancing, are being strictly followed while operating the buses. Yesterday, the Transport Department had pressed 323 buses into service for facilitating the travel of around 5,000 registered passengers in 18 districts. It may be recalled that inter-district movement has been allowed only for 3 days by the state government. The Assam government has also provided bus services to help stranded students to return home from Kota.
People of Assam who are stranded outside the state can give a missed call at 961-547-1547 number to get connected with Assam Cares. A dedicated team has been deployed to do the necessary follow-up works under the supervision of senior officials. Assam Cares team has received over 20 lakh calls so far. Apart from that, 758 cancer, heart and kidney patients who are stranded outside the state due to lockdown have also been given 25,000 rupees each. Manaspatim Sharma, AR News, Guwahati.
You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi shares his thoughts with citizens in Mann Ki Baat, says India's fight against coronavirus is people-driven. Prime Minister reiterates the importance of physical distancing, says "Do Gaz Duri Hai Zaruri" is the mantra and masks are the new norm in the fight against COVID-19. Mr. Modi lauds the role of citizens and government agencies in reaching out to people during lockdown. Prime Minister says people should not get complacent in the fight against COVID, calls citizens to join hands with 1.25 crore COVID warriors. UP and MP start the process of bringing back stranded workers from other states. Standalone and neighborhood shops open in non-hotspot zones in many states. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion program on COVID-19. Dr. A.K. Varshney, Professor and Consultant, Department of Medicine at Atal Bihari Vajpayee Institute of Medical Science, and Dr. Ram Manohar Lohia Hospital, New Delhi, will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1800-115767. Repeat, 1800-115767. You can also ask questions on telephone number 011-2331-4444. Repeat, 011-2331-4444. And post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on FM Gold Channel and additional frequencies from 9:25 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News on AIR Official. You can also follow us on the News on AIR app for updates. The number of COVID-19 cases in the country has climbed to 26,496, while the death toll rose to 824. Health Ministry data said the number of active COVID-19 cases stood at 19,868. As many as 5,803 people have been cured or discharged and one had migrated. Health Ministry data said Maharashtra has the highest number of 7,628 cases, followed by Gujarat, 3,071, and Delhi with 2,625 cases. The highest number of 323 people have lost lives in Maharashtra. Gujarat has reported 133 deaths, Madhya Pradesh 99, and Delhi 54 deaths.
Prasar Bharati has opened its repository of good news and inspirational stories on COVID-19 collected from across the country for use by all media. In its media advisory, the Press Information Bureau has said, as India fights coronavirus, many inspiring stories of health workers, policemen, journalists, individuals, organizations, academic institutions have come to its attention. It said to acknowledge and appreciate their contribution, Prasar Bharati, which runs Doordarshan and All India Radio, has followed these stories from across the country. It is happy to share these stories of bravery, sacrifice and compassion with other media houses also, so that the stories reach wider audience in India and abroad and inspires and gives hope to Indians and the world in this global fight against the pandemic COVID-19. These good news stories and more on COVID-19 from Prasar Bharati can be accessed via 3 platforms.
In Gujarat, the interministerial central teams IMCTs constituted by the Union Home Ministry are visiting hotspot areas in Ahmedabad and Surat city today. 2 separate teams have also taken stock of COVID-19 situation in these 2 districts yesterday. The teams held talks with senior officials including collectors, civic chiefs, police commissioners in Ahmedabad and Surat. Both the interministerial central teams are headed by additional secretary-level officers. The central teams held discussions with senior officials of the local administration in the 2 hotspot cities on issues like rising cases of coronavirus and implementation of lockdown measures. The Surat team held talks with State Chief Secretary Anil Mukim through video conference, during which they also discussed the condition of migrant workers stuck in Surat. These central teams are visiting some of the COVID-19 hotspot localities in Ahmedabad and Surat cities. The Union Home Ministry has directed the central teams to make an on-the-spot assessment of the situation and issue necessary directions to the state authorities for its redressal and submit their report to the central government. The teams are tasked with taking stock of different aspects like compliance and implementation of lockdown measures as per guidelines, supply of essential commodities, social distancing, preparedness of health infrastructure, hospital facilities, and sample statistics in the district. AIR Ahmedabad correspondent reports that shops except those located in COVID-19 containment zones, malls and shopping complexes have been allowed to open from today.
Large numbers of shops and businesses have started functioning outside the COVID-19 containment area from today as per the government guidelines. These shops and businesses are being allowed with 50% of regular staff. Mask wearing and social distancing are mandatory for such shops and businesses. IT and IT service industries outside containment areas have also been allowed to function with conditions. One tailor shop owner in Surendranagar expressed his happiness.
मेरा नाम नीलेश पी सोलंकी है और मैं गुजरात के सुरेंद्रनगर शहर में रहता हूँ। सरकार ने जो आंशिक 1 महीने के बाद जो छोटे व्यापारियों को छूट दी है, उसके लिए उनका मैं तहे दिल से आभार मान रहा हूँ।
As per the state government orders, the restaurants, hotels, tea stalls, pan cigarette shops, saloon barber shops, beauty parlors will remain closed. Shopping complexes and malls which witness more footfalls will also remain closed. Yogesh Pandya, AR News, Ahmedabad.
The centre's IMCT team visiting Thane instructed for stricter and effective implementation of lockdown restrictions in containment zones and stressed on institutional quarantine and more medical tests for identifying patients affected due to the disease. More in this report.
Thane has seen a spike in number of COVID-19 cases in municipal limits. The 2-member team which visited Kaushalya Hospital, Civil Hospital, Horizon Hospital, besides Parsik Nagar, Kalwa, Amrut Nagar and Mumra areas. Besides increasing the tests, the team has also stressed on caution to be maintained at fever clinics. Meanwhile, there has been a very marginal increase in the number of Navy men found corona positive on INS Angre. The chief spokesperson of Western Naval Command said all the affected cases, including the earlier 26 COVID-19 positive Navy men, are from INS Angre and there has been no spread to the staff of any other ship or submarine. A beneficiary of Pradhan Mantri Anna Suraksha Yojana from suburban Andheri area in Mumbai, Ranjana Sarve spoke to AIR about how the scheme has been beneficial for her during this lockdown period.
मेरे परिवार में 6 सदस्य हैं। अब प्रधानमंत्री अनाज योजना मार्फत मुझे प्रति व्यक्ति 5 किलो प्रमाण से 30 किलो अनाज मिला। इस लॉकडाउन में मेरे को उसका बहुत बहुत आधार मिला, इसलिए प्रधानमंत्री जी का बहुत बहुत धन्यवाद।
As per the latest data, the total number of cases in Maharashtra has now risen to 7,628 with 323 deaths reported and the mortality rate has been reported at 4.23%. With Kunal Shinde, this is Sonali Ghadar Patil, AIR News, Mumbai.
An IMCT is taking stock of the COVID-19 situation in Hyderabad and continues to visit various places to examine medical facilities and implementation of lockdown. The central team headed by Additional Secretary in Jal Shakti Ministry, Arun Baroka, has met Director General of Police Mahinder Reddy and reviewed various measures that the police are taking to implement the lockdown. The team visited the Nature Cure Hospital in the city, where a quarantine facility has been set up. More from our correspondent.
The 5-member interministerial central team is continuing with its inquiry about various medical facilities and implementation of lockdown in Hyderabad on the second day today. The central team met DGP Mahendra Reddy and held a high-level review meeting at his office, where senior officials from all 3 police commissionerates in Hyderabad have briefed the team about various measures that are being implemented for lockdown. The team also visited the Nature Cure Hospital in Hyderabad, where a quarantine center has been set up, and interacted with the doctors and the quarantined people, inquiring about the facilities and medical care over there. The team earlier also visited a farmers market at Mehdipatnam in the city and interacted with farmers about the rates of vegetables, cooperation from officials, and about maintaining social distancing. Lakshmi, AR News, Hyderabad.
The Interministerial Central Team in Chennai is making an on-the-spot assessment of the COVID-19 situation for the second day today. The 5-member team is being led by Additional Secretary in the National Disaster Management Authority, Dr. V. Thirupagas. They discussed the arrangements being taken for containing the spread of the disease with the State Chief Secretary and higher officials and the city civic body officials yesterday. Later, they visited COVID-19 designated hospitals and quarantine facilities and also inspected a migrant laborers camp in Chennai. They began their inspection today with a visit to the wholesale market at Coimbatore in the city. They also inspected an Amma canteen, which provides food to the needy at heavily subsidized prices, even during the lockdown. More from our correspondent.
Thousands of volunteers are complementing the efforts of the administration in mitigating the problems of the people during the lockdown. They approached the district administration and informed the areas they want to go to distribute the relief materials. The administration sends an official along with them so that the social distancing norms are followed and the relief distribution is facilitated. In some cases, the local youth monitor the lockdown on their own and disinfect their areas every day. Meanwhile, the intensified lockdown has come into effect for 4 days in Chennai and its adjoining areas in the neighboring districts and also Coimbatore and Madurai, and for 3 days in Tirupur and Salem. Jai Singh, AR News, Chennai.
In our series Experts Speak on All India Radio, we bring you the views of leading medical experts on COVID-19. Talking to AIR News, Dr. Sanjay Pandey of Govind Ballabh Pant Hospital, Delhi, said social distancing is key to defeat the novel coronavirus.
There is no treatment right now for coronavirus. It's very important to maintain the social distancing and the isolation, and the lockdown is an effort in that direction.
In an effort to guard against fake news being circulated on various platforms, we bring you our segment on fact-checking and mythbusters. The government has rejected a claim of a web news portal that the centre is likely to reduce the retirement age of government employees to 50 in the coronavirus crisis. Press Information Bureau said the claim made within the report is false. It said the centre is neither planning nor discussing any such move. The government also rejected another report that 5G networks spread the coronavirus. It said COVID-19 spreads through respiratory droplets when an infected person sneezes, coughs or speaks. Citizens are requested not to pay heed to such misleading information and not to fall for it, and stay home, stay safe. Following the centre's order, small neighbourhood and standalone shops are open in all non-hotspot regions of Kerala following strict social distancing guidelines. The usage of masks are also being followed compulsorily. The general markets are remaining closed in all areas. People at large are cooperating with the guidelines and avoiding crowds. And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi shares his thoughts with citizens in Man Ki Baat, says India's fight against corona is people-driven. Prime Minister reiterates importance of physical distancing, says Do Gaz Duri Hai Zaruri is the mantra and masks are the new norm in the fight against COVID. Mr. Modi lauds the role of citizens and government agencies in reaching out to people during lockdown. PM says people should not get complacent in the fight against COVID, calls citizens to join hands with 1.25 crore COVID warriors. UP and MP start the process of bringing back stranded workers from other states. Standalone and neighbourhood shops open in non-hotspot zones in many states. And with that, we end the midday news.